I've reported on American healthcare for decades, but now it's more personal. Several weeks ago, a surgeon at that hospital cut a small malignant tumor out of my lung. I picked that hospital. Well, frankly, I didn't really pick it. My doctors recommended a surgeon there, and what do I know about the best place to go? I got a couple second opinions, but frankly, I spent much more time researching which cell phone to buy. That hospital is rated best in New York by a magazine. It's the kind of thing hospitals sometimes advertise.
Proud to be named the #1 hospital in Tampa Bay by U.S. News & World Report.
Good for them, but what does that really mean? Are the ratings accurate? Do they really help people shop for the best health care? We rarely have as much information about hospitals as I had shopping for this phone. So how should we shop for health care? Let's ask two people who think about that a lot. Dr. Ron Noy is an orthopedic surgeon who says Americans should get more personalized health care. David Goldhill is CEO of the Game Show Network. When a hospital killed his father, he put his business experience to use and wrote this book about how to fix American health care. So, David, a hospital killed your father?
Well, my father died of an infection he acquired in a hospital that was regarded as preventable. And as you know, the estimates of deaths from errors in hospitals are somewhere between 200 and 250,000 a year.
It's the third biggest cause.
Third biggest cause of death every year. And I asked the question, why does that happen? Why are hospitals not incented to do that? And again, these are errors, and many of them are regarded as preventable. So where is the incentive gone wrong?
But they have an incentive not to kill you.
Of course they do. The question is, are they strong enough? And the argument I've made is that unfortunately, the customer of the hospital isn't the patient. It's the insurer, it's Medicare, it's Medicaid, and that difference explains a lot of the things that we see and are dissatisfied in the American healthcare system.
Let me just turn to what I wrote in the article, which ticked a lot of people off. For all I know, my care was good, but the customer service was awful. You had to fill out the same forms again and again, the same information. Sometimes they'd say the doctor's coming, and he would come 2 hours later, and they don't bother to email you and say, yeah, he's not going to be there for a while. Or when they dismiss you, you wait 2 hours, nobody talks to you. Why?
There's no reimbursement for good personalized care. My parents were in the hospital recently, and like you said, they had every hour they had an appointment for their preoperative stuff, but every single place made them fill out the exact same information. And when they said, hey, why am I refilling this out? I just did this 2 seconds ago. They go, oh, the systems don't talk to each other.
You have a group, Leapfrog, that is trying to change the way we rate hospitals.
Yeah, Leapfrog for roughly 20 years has been publishing data on hospital safety, and now publishes a grade, just a single A to F grade on how committed a hospital is to safety and how good the results are compared to other hospitals. And
yeah, I just discovered that New York Presbyterian got a C grade, below average on infections, good on specially trained doctors, below average on responsiveness of staff. I didn't know about this stuff.
Below average on a couple of never events too, things that should never happen in hospitals.
But patients don't know about this.
That's right. What would really help though is if we were the customer. Because when we're the
patients pay,
because then the providers chase you. And they push the information in front of you.
When I argue that, people say, we can't afford this, then only the rich would get good care.
I don't know where they think all the money in healthcare is coming from. It's $3 trillion a year. It's coming out of everyone's pocket. We're spending $800,000 per life. If people don't think they're paying for that, they're kidding themselves.
Back to customer service. I complained that machines beeped at night and the nurse would come in or wouldn't come in. Finally, she'd say, oh, old batteries. But after my column was published in the Washington Post, a hospital worker wrote to complain about this customer mentality. A hospital is not a restaurant, not a Burger King. You don't get to have it your way.
You can't sleep in a hospital with all the beeping and everything else, and the lights are on, and you got, it's all those fluorescent lights that are right in your eyes. How are you supposed to get better if you can't sleep, if you don't get good food? These are really important things that
They're
people
important?
really...
The food?
Absolutely.
Compared to the surgery?
Well, there's probably no part of the economy in which good service would mean more to producing the product. People feeling cared for, people feeling taken. When my son's appendix burst, having to fill out the same form while he's waiting for emergency surgery over and over again is terrifying. Adds to the discomfort, makes him sicker.
And let's go back a few years and remember why we got that "Have it your way" slogan.
All the people hold the lead, special order down at the bed. All we ask is that you let us serve it your way.
All right.
Burger King ran that campaign because McDonald's, which has long dominated the fast food market, made it tough for customers to customize their burger. So Burger King said,
We can serve your grilled beef whopper fresh with everything on topper. Any way you think is proper, have it your way.
competition made them both better, but people scream at me and say, you can't compare it. Medicine is much more complex than hamburgers.
The medicine is standard, okay? We know if somebody comes in complaining of some certain symptoms, we know where we're going to, what tests we're going to do, what treatments they're probably going to be, and it's just trying to figure out which one is the best for that person. But there's more to a hospital than just figuring out the diagnosis and treating. You can't tell a patient, don't move until this catheter is removed, and somebody will be with you in a half an hour, and then nobody comes there for 8 hours and they sit around, and then they're increasing the risk for blood clots or other complications.
Woman named Michelle writes, stop whining and say thanks. You know how ridiculous you sound, Stossel? Email a physician. You think an MD has time to respond to patients' email?
I give every single patient my email, my cell phone.
You're a free market doctor.
And they email me all the time.
What if they bug you?
They do. But that's my job.
Every industry would love to have a pass like that, right? Service doesn't matter. It doesn't care. For $3 trillion, it's okay for us to expect the health industry to have the same information technology and commitment to service that every other industry has. We're paying for it.
Some other criticisms. In a truly free market, society wouldn't subsidize the cost of Stossel's smoking. In a free market, he'd be dead. But just to be clear, I never smoked. Some people get lung cancer who didn't smoke. And in a free market, I would have gotten better care. I wouldn't be dead. Another one. Let's see him negotiate the price of chemo versus surgery when he's in the ambulance on the way to the hospital. Medical care is not amenable to the usual market forces.
So this is something that I hear all the time that is just bizarre. Nobody who says this has ever actually been in our healthcare system, which is so complicated, so difficult to navigate, so impossible to figure out how to get approval for things you need even during an emergency. In a consumer-driven system where the providers are competing to get customers, you do less work, not more work.
And they would have reputations. You wouldn't make the decision in the ambulance. You know which hospital was cheaper or better.
You wouldn't have unreadable bills because they want you to pay them.
Well, lots of Americans want government to take over health care, as it does in much of the world.
Get the profit out, get the private health insurance company out of there. That's right.
Michael Moore made a movie about that. He claimed government health care was better than profit-seeking business. So I pointed out that when profit's involved, people innovate.
Phones get better and cheaper.
Did you say better?
Cell phones are better than the old black phone I used to have.
I couldn't get a signal, between here and Columbus Avenue.
Aren't they better?
In fact, you know what I say to people? When are they going to invent the cell phone?
That's so stupid. Progressives' hatred of the market is so great they can't even acknowledge that competition has improved these things. Today, this does what supercomputers used to do. Government health care is like a government car, and that's actually been tried. Here it is, the Trabant, the pride of the Soviet bloc. People joke sometimes about dumb people saying he's no rocket scientist, but the Trabant was made by real East German rocket scientists, smart people, and yet it's an awful car, hard to drive, it pollutes heavily, you have to put the gas and oil in separately and then shake the car to mix them together. This was the best that governments could produce.
They're horrible. Are you kidding? Don't even use those as examples.
That's what happens when government produces things.
I understand why some people don't like the government running things now, but the government used to be really good at things.
If the government is so good at giving all this care, why are patients coming from England here because they can't get an MRI scan for 9 months? Or we get a lot of patients from Canada that go, I don't want to wait 9 months to fix my knee or my shoulder. I need this fixed now.
There is one tiny area of American medicine that is really consumer driven, and that's LASIK eye surgery and cosmetic surgery. They have to compete because they're the rare specialties where the customer always pays the bill directly. So they advertise.
Join us in reaching your pursuit of happiness.
Some of the ads are tacky, but so what?
Do you have the E Factor? Why wait any longer? You owe it to yourself to come see Dr. E.
The ads give us information, prices. LASIK eye surgery prices have dropped because of this competition. And the doctors compete to offer superior customer service.
You got movies playing in the waiting room.
Of course, we have entertainment just so someone has a better experience. Our typical waiting time is less than 5 minutes.
Why do you make the extra?
Because they'll leave. People will not stay. They have choices.
Choice, what a concept. And your practice operates that way.
Absolutely.
And they can go somewhere. How long is your waiting time?
My waiting time in the waiting room, or
Yeah.
5 minutes or less, but that's my choice. So I decided that I'd rather give better care and make less money and be happy at the end of the day with how I was treating people.
Does choice make a big difference?
I think it'll make a big difference. Increasingly, people have high deductible plans. And after a few years, they're going to realize, unless I get really sick, I'm paying my health care out of pocket.
Or health savings accounts?
Hopefully with health savings accounts.
The Obamacare
has made them more difficult, but it's a trend that I think can make us see how much potential there is for competition, choice, and the things we value and everything else: service, quality, value.